Hello and welcome to a very special episode of Lab Talk with Aptos Life Sciences, the ultimate destination of insightful conversations and the engaging discussions. Today, we are here to celebrate the incredible strength and the resilience of women around the world. As we commemorate the International Women's Day today, I'm your host of the session, Dr. Purnima Sharma, Manager Products at Aptos Life Sciences. So we have lined up the focus on empowering the women to take control of their reproductive health in today's session. And if we talk of women health, infertility is a topic that affects millions of women globally. And while the journey to motherhood can be beautiful, but it's not always easy. For many, understanding their fertility, seeking early diagnosis can make a world of difference. So in this episode, we are deep diving into the role of laboratory tests in assessing the fertility of women. And to do the honors, we have with us Dr. Abhik Banerjee, a renowned specialist in this field from Apollo Diagnostics, the Zonal Technical Chief for the East Zone, based in Kolkata, MBBS, MD in Pathology, MBA in Healthcare Management, with more than 10 years of experience and holding the crucial responsibilities across 30 labs in West Bengal and East India. He will be putting up some light on how this cutting edge medical test can provide the valuable insights in the women's reproductive health. Welcome, Dr. Abhik.
So, thanks, Dr. Purnima, for the nice introduction and kind words. I first of all congratulate and also I thank the entire Aptos team for organizing a very good webinar on this particular topic, which is actually a very pertinent topic in today's date. So, without further time, we can proceed and we can try to interact with our distinguished participants and people.
So, thank you. First of all, now to brief this talk to our audience out there, Dr. Abhik will guide us through the essential tests that can reveal the crucial informations, taking us from the hormone levels to the genetic testings, why this fertility matters, explore the types of tests which are available, and discuss how the lifestyle choices can impact on this fertility, health, and much more. So we are excited to explore this vital topic with you, Dr. Abhik. So
Yeah.
to start out with, let's have the introduction on the women health and what is the role of assessing this fertility in women.
Yeah. See, actually, we all want to see a better generation, next generation. So we all know that the females are very important for the pregnancy, and this a very pertinent, a very important thing that they have a good fertility. Actually, the status in India, current status, if you take the statistics of 2022, the fertility has come down, and per woman, the current birth rate is little more than 2.08, like that. It was in around 1950, it was around more than 6.5 around. So we can understand that with the education, awareness, and empowerment, as you rightly indicated, of females, and also their better half like males, the fertility has come down. But whether we need to, with the rising population of India, like 140, more than 140 crores, we are now the first position. But still, there is a concern that in around 2025 or 2026, the fertility rate, as I told, it is little more than 2 currently, may come down to 1.25 or 1.50, like that thing. So it is not only the population, what I mean to say, that the problem in India is the young decline in young generation. The median age is 28 if we consider the rising age, the actually the people who are actually staying with us more, that is the aging population. So productive age group people, if there is a decline in the fertility rate, then there will be a challenge in the economic and socio-economic growth of India, and that is the concern actually. So with many government initiatives like availability of contraception in the rural areas, even in the very remote areas also, and in the increase in the age of marriage age group of both female and males, there is already a chance of reduced fertility, because we all know that age is an independent determined factor, which also with increasing age there is a reduction in the fertility in females. And as with globalization, we are taking help, we are taking actually, we are mimicking the Western society, Western culture, the food habits, the smoking, and alcohol intake, even which is very much prevalent in young generation, especially the females, there is a rising concern, and it's a major predominant cause of reducing fertility in decreasing fertility in women in current in India. Also, if you can notice that in India there is a very increased rate of in hypothyroidism, thyroid disorders, okay, and there is metabolic X syndrome, like where the diabetes, obesity, and multiple this kind of disorders are actually in combination, it is present in a particular female, like that. So these obesity and those things, junk food and smoking, alcoholism, etc., they are leading to and reduced fertility in India in women. So we have to be definitely concerned about this.
So, as you are rightly marking about the percentile of fertility reducing, a lot of factors, education, like empowerment of both the genders, this is definitely going to play an important role. But as you rightly marked, the generation impact of the eating habits, your daily activities, their lifestyle. So basically, people when think of fertility, they often feel it associated with the ability to conceive. But it's more than just about pregnancy. As it's marked, it's the overall the reflection of the women's reproductive health. So please enlighten us on some points like how these factors are marked, putting up the eating habits, your daily activities, your lifestyle plans, which could be an important role in this process.
Yeah, actually, most of the, if we consider the different reasons of infertility in female, as there are ovulatory dysfunction, like there may be some uterine abnormality, there may be some problem in the fallopian tubes, but all these actually, why these things are happening? A very important reason what we have noticed during our day-to-day experience handling patients, handling lab tests, etc., the lifestyle changes. So people are actually habituated. The females are actually not only females, but their male counterparts also. We are habituated more with junk foods. You can
Easy
see
way.
even, yeah, in East India there is a actually rice eating population, very huge rice eating population, and there has been a correlation between increased rice intake with PCOD, polycystic ovarian disorder or polycystic ovarian syndrome, PCOS. So the food actually they should be to improve your fertility, that should be rich in antioxidants, okay, minerals, minerals, vitamins, and those things actually. But that is lacking from these junk foods like pizza, burger, etc. So please try to increase. What my suggestion, our advice is just to try to increase intake of fruits. Keep at least one fruit daily in your as much as possible. It may be any seasonal fruit, any, but these are high in antioxidants, in minerals, okay. So this kind of fruits, and you can have a balanced diet, like it's not only junk food, or it's not only the carbohydrate rich fruit, but there should be an amalgamation of both carbohydrate, protein, fat, vitamin, minerals. Even fat is important. It's not like that we have to completely eliminate fat from our diet, because the cell, the unit of life, that cell lining is also prepared from lipid, fat. So everything is important, but what is important is healthy diet. And another thing, if you can consider that we are currently habituated with a very sedentary lifestyle, especially the productive age group, the young population who will actually give birth to children. Those females, those males, they are actually habituated with this kind of sedentary lifestyle. We are having air conditioned, I mean, office, air conditioned home. We are traveling by cars, our personal cars, and everybody has their own scooty, bikes, etc. So there is very sedentary lifestyle. There is no physical exertion. That is very much important. And you can see the rising trend of obesity, morbid obesity in the BMI is rising more than 35, 40, etc. So all these actually are leading to increased trend of infertility. And there are problems because we can see that even patients are coming to us, like females are coming to like 23rd, 20, 23, 24 years females. We will discuss later on, but the AMH is severely low, below 1, AMH, anti-Mullerian hormone. So we have to actually not only diet, healthy diet, but we have to also give stress on regular physical exercise. It may be it may not be a very hectic exercise. It may be even 30 minutes or 40 minutes brisk walking, daily walking. It might be a freehand exercise, and you can also I mean think about the meditation yogas because the stressful life, the tense environment, tension in the office, in office life, in your personal life, etc., these are also actually impacting your normal ovulation, your normal menstruation, menstrual period, menstrual. You can see many young females actually they are having irregular menstruation. The periods are not actually regular. Sometimes it's oligomenorrhea, sometimes it's amenorrhea, like that. Anything, it's not, I mean, very very difficult. So please give stress on not only the good healthy diet, avoid junk foods, avoid smoking, alcohol, etc., and obviously some kind of physical exercise daily. Okay, so that will be very much helpful to improve your fertility status.
So, as we could understand from this poll for my listeners, although it seems quite alarming, the situation which we are into currently, but a very simple funda that we are listening since our childhood, having a good balanced diet, having regular physical exercises, doing the yoga or meditation, that's, I think, good then enough to have a good lifestyle, and finally, the end result is always ours.
Sure.
So, since we are also growing with the medical technologies, with having number of tests available. So, what would be your take of putting up in this way? Like, what are the tests which are available? Since if women are more informed about their decisions, about their family plannings, and even if they could provide it with early warnings for the potential health risk, that could definitely affect their pregnancies in the future. So, how these lab tests can assess their fertility or emerge as an important factor when they are thinking of that phase?
First of all, we have to understand, even our audience should understand what is infertility. Infertility is inability to achieve a successful pregnancy in spite of regular unprotected sexual intercourse for 12 months. So 1 year you have time for, with regular unprotected intercourse, you have time to get achieve pregnancy. But if it is not there, first what is important, don't experiment by yourself, don't Google or like that, but you take help of an expert. And as I told in the first beginning of my talk, that what is important, that many times the age for marriage actually it is in the, it is being skewed at the higher age, higher side. Many, I mean, females are being actually they are getting married instead of 22, 23, 24. They are getting married after 30. So there is a obvious age related decline of the ovarian reserve, right? So because it, which every menstrual period you are losing eggs. Okay, so with every menstrual period, there's a decline in your ovarian reserve. So if the woman is less than 35, yes, you can be tested after 12 months when you are not getting that kind of successful pregnancy. But if it is more than 35, the female is more than 35, in between 40, then she should be actually evaluated even after waiting a 6 months period, because you have less time with you. And if the female is by chance more than 40, because sometimes the second pregnancy or like that, once there's a financial impact also, because consecutive children or like that, so sometimes people are waiting. Even we have seen females who are taking pregnancy after 40 years. So in that case, if you are not being able to, in case of your first child, if you are not being able to take get a successful pregnancy, you have to be tested even earlier, even not to be not to wait for more than 6 months. So that is important first of all. And now the tests are varied. Actually, first we have to understand there is no blame game here. The females are usually in our society, sometimes they are only considered the only one responsible who due to this unsuccessful pregnancy. But it's not that, because if you consider the reasons or etiology of the infertility, you can see that both females and males are equally, I mean, they may be affected. 30% reasons for female, 30% reasons for male, and there may be a combined factor also, both male and female. So that is another 30%, and 10% may be idiopathic. That means we are not sure what is the problem with which partner. So if you consider that, so the treatment, if you first you are not being able to achieve pregnancy, then first both partners should visit the infertility specialist, so that both partners can be the history taking, physical examination, and that should be started simultaneously for both the partners. That is most important. Then now, as we are discussing about only female, there are two types of test, radiology and pathology. So pathology is test basis like hormones, hormone profile, and there are some associated tests like thyroid, TSH. We have to test prolactin. But basically, these all tests, they actually try to capture whether there is a problem in the ovulation ovulatory dysfunction, or there is a problem in the fallopian tube, or there is a problem with the uterus or any other factors. So all these tests like that. So if you consider, there are some hormonal tests like AMH, anti-Mullerian hormone, which actually gives you indication about your ovarian reserve. I prefer that if it is AMH more than 1, usually the success for a successful pregnancy is very high chance. If it is less than 1, there is a concern. If it is less than 0.5, the chance is very low. In case you have to take the help of IVF or like that, in vitro infertility treatment. And if you find that there are other tests like LH, luteinizing hormone, follicular stimulating hormone, these are also important. Usually in your menstrual cycle, day 3 to day 5, they choose the day 3 sample of LH, FSH, etc. They test. AMH is cycle independent. You can test at any point of time, but if you test together, so you can take the day 3, day 2 to day 5 sample like day 3. And there are other tests like, as I told, prolactin. So if your prolactin is high, then there is a possibility that you are suffering from hyperprolactinemia. There are good medications available. You can control your check your prolactin level and you can achieve your pregnancy. If your LH and FSH ratio, if your LH and FSH ratio is more than 3:1, there is a chance that you are suffering from PCOS or polycystic ovarian syndrome. So there are treatments for ovulation induction like clomiphene citrate, etc. You can achieve pregnancy. So there is always a hope. But what is important that you have to test early so that the treatment, right treatment can be initiated early. There are radiological tests like hysterosalpingography, pelvic ultrasound, antral follicular count, which is a type of ultrasonography, which gives you an indication how much your ovarian reserve is, how many ovums you have left for to get a pregnancy. So these are the various tests, and TSH. Please important remember, this is very important test, because if the TSH is high, maybe you are suffering from hypothyroidism. You have to first control your hypothyroidism with Eltroxin or Thyronorm supplements, so that under control, and you can gain you can you can easily achieve a successful pregnancy. So start early, take the right expert advice and get tested, and so that you can actually you can go forward for a perfect management, timely management, and you can achieve a very good news soon.
So I think taking this in a way for our audience, like it's very important first, right age, then your right consultation, I think, and finally the right tests, which could be either on the hormonal levels or the others one. But there is another thing which is recently, because we have the latest sources, we have the latest advances in the fertility testing. So there are it has come a long way with the new advancements which are emerging. So please enlighten us on those latest advances and the promises on development of this field, which could be basically from genetic testings or another methods which are into the study these days that could be of another support to our listeners.
So basically, must have heard nowadays that genetic testing for infertility. Actually, if there is a very low chance of pregnancy, if you're infertility specialist, he understands after doing all these tests that like AMH is very low, maybe 0.3 or 0.5. That means there is a premature ovarian failure. It might help that you have to undergo therapy for in vitro fertilization, IVF. Sometimes you can understand, you can see, you have come across news in newspaper that affluent families, females from affluent families, who can think that even from actress and they are thinking about pre-implantation genetics testing or pre-implantation genetic screening. What they are actually they are doing that, they are freezing the egg which can be used in future, because now they cannot take that, the pregnancy, the time constraint and those things. So they have decided that they will take the pregnancy after their, they from their office or those kind of things, stresses little bit diminished, maybe they will take after some time after the break. But now when they will get free from all these commitments, maybe by the time they will lose their ovarian reserve. Okay, so there is very few, limited chance at that time. So what they are doing, that they have to select good ovums or like that, they will freeze that and they can use in future. So that selection of that kind of ovum, good ovum, and those things, actually those genetic testings are available, so that you can identify and you can use. There are several other tests for cytogenetics like karyotyping, etc. if you find that your chromosome analysis, like that thing, if any chromosomal disorders are there, if the, I mean, the woman is, after all doing all these things, they want to understand the root cause of why the actually there is any genetic level problems, anything, those genetic tests are well available now. Definitely these are in very high, I mean, they're a little bit costly still now, but and they are available only in metro cities, only in few labs, but these things are available, which was previously not available in India. So but what is important, don't get carried away, don't do the test without any experts advice, because which test you will require as per your clinical history, your clinical examination, physical examination, your doctor will be the right guide for that, and accordingly, step by step, sequentially, he will prescribe or he will advise for those tests. So that is important, that after your each case is different, each patient is different. Okay, so maybe both or two or three patients, they are suffering from infertility, maybe in the same age group, but the reasons are different. So which test need to be selected and how it will be managed, whether you will use routine test or whether you will go for the genetic test, your doctor will be the best guide for that. So take help, don't do any unnecessary testing, because nowadays in laboratories also you will see there are many package tests available, fertility assessment, etc., etc. So unnecessary, without any advice or guidance, if you do the test and there is little bit change as per the values, as per the reference range, maybe they are not clinically significant, but you will unnecessarily be stressed or tensed after seeing those results, and those, not only those are wastage of money, but that also further increase your stress level. So don't do that, that is my only advice. So there are lots of hope, there is always a ray of light, many successful good tests and as well as treatments are available nowadays in India, and it is not very difficult, even for very difficult, very challenging cases to get or achieve successful pregnancy with right kind of test and right kind of treatment.
So yeah, so that's really so true, because as the science is progressing, the options of assessing and improving fertility continue to grow. We are offering women with more choices, more control over their reproductive health. But as per the basics, eating habit, your daily activity, your lifestyle, they are just critical in supporting all the fertility and small changes that can make a big difference. So that was incredible, insightful session, Dr. Abhi. Obviously, this Women's Day, special thanks to you for having this talk with us. That has been truly eye opening. We have been fortunate to explore such valuable information with you. So it's more than clear that we have so much to take away from this wisdom that's shared here over this Aptos table, and here to empowering women with the knowledge to take the charge of their own health and fertility. So I can have a final statement from your side too before we close this session.
So as I already told, that there is always a ray of hope. If you find yourself that there is any problem, any dilemma, if you are not being able to get that kind of successful pregnancy or achieve, first you contact an expert. Okay, please don't Google and don't I mean searching internet and those things. From there are many videos available, but as I told, each case is different. Okay, so you have to get the right advice and right treatment with modern laboratory tests available in different parts of the city, different, all your, these are very close to your house, and experts, fertility specialists, obstetrician, gynecologists are available. So it is not very difficult nowadays to achieve a successful pregnancy and try to improve your fertility status. It is not, you will not be, it is no, it may not be required for you at all if you have a very, follow a very good lifestyle, because as I told, the mimicking the lifestyle of the westernization and globalization actually impacting our fertility status, fertility profile. So good food, good habits, thinking well, and those things actually will help you, and a good lifestyle, and please avoid smoking and alcohol. These are actually ruining our life, and over the counter drugs, what I missed to say earlier, these taking the drugs, medicines over the counter from just from chemist, anything without any, I mean taking any advice from the expert, this is very detrimental. And so this kind of bad habits actually ruining our fertility potential. So all the best to all of you, and a very happy Women's Day from my side.
Thank you so much, Dr. Abig. So basically, this Women's Day, we want to not only highlight the importance of understanding and prioritizing our health, but also to encourage all women to take the proactive steps in ensuring their reproductive well-being. Whether you are planning a family or not, just learning more about your body, this conversation is one you won't want to miss. Thank you for tuning in for today's episode. Thank you, Dr. Abik, for your insightful session. So let's don't forget to follow us on our Reptos social media platform for more insights. Until then, stay connected, stay informed. Thank you.
Thank you. Thank you.
Aptos Life Sciences. Advancing science with quality.